Hello and welcome back. Today's topic is going to be one that is one of my favorites. It is antisocial personality disorder. So one of the things that I really enjoy doing as a clinician is providing treatment for personality disorders. A lot of clinicians do not like treating personality disorders. I really enjoy the challenge. And there are two in particular that I enjoy treating. And the one that I'm going to be talking about today is antisocial personality disorder. Now, with antisocial personality disorder, first off, let me explain what a personality disorder is. A personality disorder is a pervasive way of being. So it's not that symptoms show up in just one area or another area. It is throughout the person's life, and they are deeply entrenched behaviors that are very stubborn to changing, which is why I like treating them. I enjoy the challenge. So with antisocial personality disorder, it is a personality disorder that, of course, is more prevalent in the prison system and with people that have conflict with the law, because one of the criteria of antisocial personality disorder is that people break the law when they have this disorder, or they violate the rules and norms of society. So they are people that are engaged in criminal behaviors. So some of the other symptoms, and I'm going to go refer to my notes so I make sure I cover all of them in a logical form. So first off, in order to be diagnosed with antisocial personality disorder, one of the criteria is that there has to be evidence of conduct disorder before the age of 15. So that means that people that have antisocial personality disorder, they were already breaking the rules in a significant way when they were children. And with that, they're stealing while confronting a victim as conduct disorder, setting fires, animal cruelty, sexual assault, bullying, running away from home, violation of the rules and norms. Even as children, they were already showing signs that they are on a trajectory to become antisocial personality adults. So you have, first off, evidence of conduct disorder before age 15. Then you also have to be at least 18 years of age in order to be diagnosed with antisocial personality disorder. The behaviors before that are going to be diagnosed as conduct disorder. And the reason for this is that in mental health, we don't want to say something is a personality issue until they pretty much reach that age of majority. I think it's pretty arbitrary, that age of majority, but there has to be some guidelines so that way we all know the language that we're speaking in mental health and what we mean when we are giving these diagnoses. So, conduct disorder before age 15 is a big criteria. The other thing now is that the person needs to meet at least 3 of these criteria to meet the diagnosis of antisocial personality disorder. The first one is that they continue to do behaviors that can get them in trouble with the law. So that's one of the first ones. The second one is deceitfulness. They con others, they take advantage of others, they use aliases, they lie to further their agenda, whatever that agenda is. And it's usually very self-serving. They're not lying for the greater good. They're lying so that way they can get over on people, avoid consequences, take advantage of situations monetarily, take advantage of situations sexually. It's exploitive, that lying. The next one is impulsivity and failure to plan ahead. That impulsivity looks like that they take risks and don't think about consequences. So a lot of times I'll see people that have antisocial personality disorder that they do behaviors that if you stopped and thought about it for a second, you would realize that you're going to get in trouble. But that impulsivity is not able to be contained. They just act without thinking of those consequences. So that's another criteria. And remember, there only needs to be hitting 3 criteria in order to meet the diagnosis. The fourth one is irritability and aggressiveness. People with ASPD, they have one of the big symptoms of being irritable and aggressive. Everything just seems to annoy them, especially when they're not getting their way. They are not people that generally stop and use assertiveness techniques. They tend to be very, very aggressive, ready to fight all the time. Number 5 is reckless disregard of safety for themselves and other people. So these are people that they'll mash the gas in a high-speed chase because they want to avoid consequences. In the prison system, these were individuals that might cut themselves in order to facilitate transfer to another institution because they don't want to be at this institution anymore. They are more willing to take risks that have the potential to end in death. These are people that can calmly and coldly break into someone's house in the middle of the night with a risk of being shot and killed. That's why I always find it funny that people are like, oh, guns prevent people from breaking into houses. People with ASPD, they don't care about the gun. They don't think about the gun because they don't think about themselves and their own safety. They don't have that rationale behind them. They take big risks that make no sense to those of us that have, foresight, where we're going to be like, oh, that consequence could end it. That behavior could end in the consequence of me being dead. They don't think about that, which is why they have a higher incidence of being killed. The other thing that they have is consistent irresponsibility. They cannot keep a job. They will often leave a job because they got into an argument or they feel like they're being treated unfairly, and they will walk out without a plan about how they're going to pay their bills after walking out. They tend to keep jobs for a very short time, if they keep them at all, and then they tend to blame the loss of the job on everybody but themselves. They also tend to not pay their bills, and they will sit there and they will justify not paying their bills. They're just irresponsible financially. They are irresponsible in terms of being able to keep work. It's just not in them to do that. Then the next and the last one that they have is a lack of remorse. Or they blame their behaviors on other people. And so what that means is that they do these behaviors, they harm other people, and then they justify it. They'll say things like, sucker born every minute, and I can't help it that they were that dumb that they fell for it. There is a lack of empathy for other people's viewpoints and for what other people are going through. Now, with all this being said, where does ASPD come from? Well, we are not 100% sure, but we do know that there are certain risk factors that can lead to ASPD later on. One of those risk factors is genetics. If there is a lot of antisocial behaviors already in the family, like uncles that have gone to prison, dads that have gone to prison, mothers that have shown neglect or abuse towards their children, they have antisocial traits, that tends to be genetic. And we know that it's genetic and not just environmental because you can remove the child with an adoption and that child will still show those behaviors. So there is a genetic component. And they also don't know if it's a chicken or an egg type phenomenon, which came first, but there tends to be a difference in the prefrontal cortex, the part of our brain where we actually are able to control our impulses. It tends to be smaller in people that have antisocial personality disorder. That's not for everybody that has antisocial personality disorder. There's a breakdown about sociopathic behavior, psychopathic behavior, and antisocial personality disorder. They're all three different types of diagnoses, but in terms of diagnosing for mental health, we only have ASPD in our DSM-5. That was a lot of different letters, but you can Google it for more information, or if you would like me to break them down in another video, leave a comment and I will break them down in another video. But for some of them, especially for people that have more psychopathic tendencies, there tends to be a difference in that prefrontal cortex and the amygdala. With people with ASPD, there tends to be a bigger difference also as well with that prefrontal cortex, where we kind of help with impulsive behaviors. Well, we also know that people that grow up in chaotic households, they tend to have antisocial personality disorder. So if there is harsh and inconsistent parenting, you're more likely to, if there's a predisposition there, you're more likely to go ahead and kind of develop that antisocial personality disorder. That's not 110% guarantee. There is that link though. Also, what we find is if there is ADHD and conduct disorder, you're more likely to start going into that antisocial personality disorder. And I also find really fascinating is they did a study. And what they did with the study is they showed a picture on the wall. And what they would do is people that everybody would get like a small little mild electrical shock. Now, people that had antisocial personality disorder, every time they saw that picture and got a shock, it was like a brand new experience. So they would see the picture and they go, oh, a shock. They would see the picture, they would go, oh, a shock. It was new. Those of us that don't have antisocial personality disorder, we would look at the picture, get the shock. The next time we would see the picture, we would brace for that shock. We were able to anticipate that that was going to be a consequence of seeing that picture. People that have antisocial personality disorder tend to not be able to make that link. So what we're looking at are brain abnormalities and a nervous system and a genetic makeup that make it where people might not be able to learn as effectively from consequences as those of us that have it already hardwired inside of us. Their hardwiring is just a little tiny bit off, and so there are things that need to be done to kind of help them compensate for that lack of hardwiring. Now, also, with ASPD, it is kind of a strange thing that we don't really understand. The symptoms for a lot of people tend to die down when they're in their 40s. We don't understand why. We don't understand what changes are occurring, but we do know that a lot of the criminal behaviors tend to die down in the 40s. And there had been before where there was kind of, well, they might be dying off sooner, and that's the reason we see it. But it's not even really that. We just don't understand why these behaviors lessen in that fourth decade of life. Now, like I said in the beginning of the video, I love treating personality disorders. But to treat ASPD is extremely difficult because the person that has antisocial personality disorder usually doesn't acknowledge or accept that they have antisocial personality disorder. It is pretty much everybody else that is suffering the consequences of this personality disorder. The person themselves will sometimes start seeking treatment on their own when they're tired of those painful consequences of going back and forth to prison and jail, of being physically harmed because of their behaviors and all that stuff. That's generally when I can jump in and kind of start working with them because they're just tired of that lifestyle. A lot of times I'll have family members that say, what can I do? Basically, you can encourage them to get treatment with somebody that knows how to treat antisocial personality disorder. But the number one thing that you need to realize is that you have got to protect yourself. People with ASPD, this is just who they are. And people that have family members that have ASPD, they tend to take it personal. They tend to think that they are doing something wrong or that the person doesn't respect them or whatever it is. The thing is that people with ASPD, they cannot see what they are doing. That is part of the disorder, is they have a lack of insight into their behaviors. So they are not purposefully going out of their way to harm you or hurt the people in their lives. It's just the way that they are. And I think sometimes if people can step outside of those painful feelings when they're dealing with somebody with ASPD, it can make it much easier to put down boundaries that are necessary to protect yourself and your well-being. And I think that's one of the most important takeaways when dealing with somebody that has ASPD. Because people ask me, how do you deal with these personality disorders? Because the other one that I deal with is borderlines, and that's a whole other category of people that have issues with harming other people, hurting other people, but theirs is a different rationale behind it. But the thing that I do to protect myself is to make sure that I'm always aware that it's not about me. They're not choosing to go after me or pick at me or do anything like that. This is a disorder. This does not mean that I do not hold them accountable for their behaviors, or that you should not hold them accountable for their behaviors, or that the court should not hold them accountable for their behaviors. Oftentimes, the only thing that pushes these people to seek out help and get help and make the changes that are necessary to live full and productive lives is those negative consequences that they themselves have earned. The more that we take away those negative consequences, the less likely they are to reach out and participate in treatment. Also, what we also need to realize is that when we are pushing them to make these changes, whenever they are making a positive step in the right direction, that is a big deal that needs to be celebrated. That does not mean, however, that we go ahead and we lift all those boundaries because they are making one good step. Slowly but surely, they need to earn back the trust that they have lost. They also need to be rewarded and praised for any steps that they do to move in a direction of living a pro-social life. So if you have any questions or any concerns, or if you would like more information about antisocial personality disorder, just go ahead, leave a comment in the comment section. Also, if you would like to see different interventions that do work with antisocial personality disorder in terms of you and what you can do, please just let me know, and I'll do a video for that as well. And if you find this helpful, once again, please like and subscribe. That way I know that you found it helpful and I can do more videos about this topic. I think it is a very misunderstood topic, and I feel like if people had more understanding about it, we could actually encourage people that have these behaviors to get an accurate treatment. And like I said, one of the big issues is that the people themselves have to acknowledge that they have a problem, and they have to participate in what is sometimes a very difficult and hard treatment to complete. But it is possible. I know this to be true because I've helped people that have this disorder, and I've helped them learn to manage their behaviors in a way where they don't suffer negative consequences anymore, like prison and harmed relationships. So if you have any questions, please just go ahead and leave a comment. Take care.